Hello, I'm Dr. Haig Satrakian, bringing you a little POCUS review just in time for your next pediatric patient. Today we'll be talking about ultrasound-guided venous access in children, with a focus on selecting an access site and a venous catheter to match it. When you already feel comfortable using the basic functions of your ultrasound machine, as well as a few basic techniques to identify veins, we can build on that foundation and look for an auspicious site for venous access. We'll review options in the upper arm, neck, and lower extremity. We'll then talk about how to select a catheter to match the vein you identified. As you may have observed, most searches for venous access sites start in the hand and forearm. We recommend that you start in the forearm as depicted here and gradually advance your search up the length of the arm to the brachial and basilic veins as necessary. While distal veins are relatively superficial, they tend to be smaller targets, and you may be asked to look with the ultrasound when distal veins have already been attempted. More proximal sites, while larger, sometimes are closely associated with more sensitive structures and are often slightly deeper, adding a layer of complexity to the cannulation technique. Here we see a view of the veins we might access at the level midway down the humerus. In this position, we have to be particularly mindful of the easily collapsible basilic vein, as well as the nerves that are closely associated with this vascular bundle. The cephalic vein may be very superficial and a good option for some patients. It is often visible, superficial to the biceps muscle. We are familiar with the saphenous vein as a frequent site of venous access for young infants. It is often superficial just proximal to the medial malleolus and can be as large as the brachial vein in some children. This is the typical appearance of the saphenous vein as it courses just superficial to the tibia. Here we see the characteristic position of the external jugular vein as it crosses over the sternocleidomastoid muscle. This access site is noted to be particularly sensitive to the position and volume status of the patient. We view it here in its very superficial position overlying the sternocleidomastoid muscle. If you see a vein at an accessible location on your patient, are there any other characteristics of the vein that you should keep in mind? In fact, the size and depth of the vein in question play an important role in how suitable it may be for cannulation. The available literature suggests that veins located at a depth between 3 and 16 millimeters, and that are greater than 4 millimeters wide, provide the best targets for most operators. This is a lot to consider, so let's review what you've learned so far. You now know how to distinguish veins from arteries through compression, to avoid non-vascular structures such as nerves, to use color flow and color Doppler to highlight vascular structures, and to distinguish arteries from veins, and to consider size and depth of veins. Putting these skills together will help you select an ideal vein for cannulation using ultrasound guidance. Now that you've selected the perfect vein, we have to move on and select the right catheter for that vein. In most emergency departments, you have many choices, so let's review how to narrow them down. In general, a catheter requires adequate space between itself and the vessel walls for it to function properly. A mismatch in catheter and vessel size can result in vessel injury and thrombosis, amongst other complications. Here we see the catheter vessel ratio tool, which we can reference to help us select the proper catheter size for a given vessel. You can match the top row, the vessel size, with the column to the left, the catheter size. A green box represents a good match between catheter and vessel size. For example, if the vessel you've selected is 3 millimeters in diameter, you see that a catheter as large as 18 gauge is acceptable. As a rule of thumb, the catheter width should be no greater than 1/3 of the vessel lumen diameter. Catheter length is the next factor to consider in selecting your equipment. Experienced operators strive to get at least half of the length of their catheter into the vein. The available literature suggests that if you're able to get 65% of a catheter into a vein, it's very unlikely to become dislodged. As a quick rule of thumb, if a vein is greater than a centimeter deep, reach for a 1.75 inch or longer catheter. If a vein is less than 1 centimeter deep, a 3/4 inch catheter may suffice. Now that you know how to select a vascular access site and the catheter to match, you'll want to review our next video on the cannulation technique. If you wish to read more into this topic, a list of references is provided here.